Well, the numbers are staggering. The epidemic is real. More than 37 million Americans battle substance abuse, and nearly 1 in 4 are opioid users. Tonight, WTOL's Tatiana Cash, she introduces you to one woman who suffered a serious accident. But that woman opted for something different to help with the pain. And we do want to warn you tonight, this story does include images that show a graphic injury.
What started as a fun 4th of July celebration with friends quickly turned dangerous. Fireworks shot off but didn't light up the night sky. Instead, they exploded into the small crowd, hitting India Alshafer multiple times.
I would have been looking at not only skin grafting, but more pain, a longer road ahead, and months and months of therapy if that would have even gotten me to the place that I am today, walking pain-free with no limp.
2nd and 3rd degree burns on both of her legs. As a rehab tech at Integrated Medical Group, her boss, Dr. Megan Parks, heard about the incident and immediately wanted to help.
If we couldn't have found something, I was trying to fly her out.
The answer? Purified amniotic fluid, a regenerative treatment.
It follows FDA guidelines and it has growth factors and a thing called angiogenesis, which is new blood flow. If you looked at one of the pictures, it was white. It was because there was no blood flow. So it actually created new blood flow and healing properties when we misted this on it.
She says the process is simple.
Basically had her clean it right before, and then we sprayed this on that area, and then we just then covered it with ointment and lotion to make sure it was hydrated, and she had no pain.
I was like living on hydrocodone every 4 hours. I needed to just to be able to just lay there without being in excruciating pain. And since yesterday, I've taken 2 ibuprofen every 8 hours.
Unfortunately for some, accidents like this can be how addiction starts. In the U.S., approximately 2.1 million people have an opioid use disorder, with 130 people dying daily from overdosing.
Making sure that I don't go down a path.
Michaela Taylor, Vice President of Brightview Health Clinic Services, says alternative treatments can be a good choice for anyone. But pain treatment is not a simple path, because addiction or not, everyone is different.
There's nothing wrong with taking medication. Like, taking medication of itself is not a bad thing. It's just wanting to make sure that you're not putting yourself in a place where you're abusing that medication and self-medicating, and then in that way going down a path that can take over your life.
The blow of you're gonna need skin grafting, you're gonna be in the hospital, like your life is, it's a dramatic change, especially going from how active I was before, so.
This could lead to spiraling.
And that's a totally normal human emotional response, right? Like, all of these things happening at once, and it can be overload our nervous system to feel like that we know how to cope with that. And so I think the best possible thing to do is to seek out help and recognize that there are people that are equipped and that really want to help you navigate through that so that you aren't stuck there.
Thus, alternative therapies and open conversations are important, especially when faced with potentially long-term opioid use. Alshafer says family and employer support, along with regenerative treatment, targeted the pain and the injury, making a world of difference.
That's truly given me my life back, more than I can even understand. I was off work for 10 days, so I've been back since the 13th of July. I was looking at being off work for a minimum of 30 days, if not more, with skin grafting, doctor's appointments, all of those things.
Now, India and Dr. Parks talk impressive healing.
How was your day?
My day's fantastic. I had my last appointment at the burn center today, so we're moving and grooving.
In Defiance, Tatiana Cash, WTOL 11.